Hi everyone, I'm Dr. Tiffany Dzugan and I am a naturopathic doctor in the GTA. I currently practice in Etobicoke, Burlington, and virtually serving clients all over Ontario. Today I'm going to talk about vitamin D. Considering we are heading into the winter months and cold and flu season and just this little thing called the COVID pandemic we've got going on around here, I thought we would chat about vitamin D and all of its benefits given the current climate. So, vitamin D is probably one of the most common deficiencies I see in my practice. I could probably count on one hand the amount of times I've seen a good vitamin D number on blood work without someone supplementing. So it really is something that a lot of people can benefit from taking. I recommend it often because it does have, number one, it's a very common deficiency, but it also does have very sort of widespread benefits among lots of different health concerns. So it's something I do recommend often. And there's a couple of ways we can sort of go about supplementing with vitamin D. Obviously, the best, most preferred one would be time out in the sun, which we don't always get a lot of here in Canada, especially during the winter months. So some of you may be suffering from something called seasonal affective disorder. That's when we tend to get a bit of low mood during the winter months, and that can really be attributed to vitamin D status. So that's something for you to look into. But yeah, so that would be the preferred method of getting vitamin D, obviously, directly from the sun. If you're going to supplement at home, there's a couple of things you can do. Vitamin D drops are what I always recommend. They're just really well absorbed. You must take vitamin D with food because it is fat soluble. So if you take it away from food, you're not going to absorb it at all. You can definitely do that. The recommended daily amount for adults is 1,000 IUs, and for children, it's 400 IUs. Like I said, most people are deficient. Most people need a lot more than that. However, anything over 1,000 IUs is considered a prescription. So you'll need to discuss that with either your medical doctor or a qualified naturopath to get a prescription for that. The other way we can supplement vitamin D is with injections, which I do a lot of in my practice. They'll benefit those of you who forget to take your supplements at home, or if you need a really high dose over a really long period, that can get kind of taxing supplementing at home. So it can end up actually being cheaper and easier to do injections once or twice a month just to kind of get you up to a good level. So with that said, blood work in regards to vitamin D is actually super important. Blood work can really dictate the acceptable and appropriate dose that you should be doing on a daily basis. And vitamin D is one of the things we have to be careful of when we're doing high doses, because we can actually get to a toxic level, which is not the same for all nutrients. So it's something we need to be safe with, and that's why I always recommend getting vitamin D blood work before we do any really high dose supplementation. It is definitely worth the money. So let's talk a bit about the benefits of vitamin D. They are super widespread throughout our whole body and lots of body systems. We can particularly see outward benefits for things like skin and digestion, and mood is a big one. Vitamin D acts on the intestines, the bones, the kidneys, and the parathyroid gland. So that gives you sort of a general idea of how widespread it acts. And so I use it for treatment of things like autoimmune disease or immune support or digestive concerns or skin concerns like eczema and psoriasis. Even things like depression and anxiety and seasonal affective disorder, as I mentioned, can really benefit a lot from vitamin D. And especially with the new research coming out about benefits of vitamin D with COVID and sort of improving COVID outcomes, it's something that we should all sort of be aware of, if not be actively supplementing with at home. So I would encourage all of you to seek a healthcare provider who's qualified to order blood work for your vitamin D. Feel free to reach out if you don't really know where to go from here. And let's get you supplementing at an appropriate dose so that you're feeling your best self going into this winter season. Again, I'm Dr. Tiffany Dzugan. I'm a naturopathic doctor in the GTA, and I look forward to hearing from all of you.